Schizophrenia is a severe mental disorder that affects how a person thinks, feels, and behaves. Individuals with schizophrenia often experience hallucinations such as hearing voices or seeing things that aren't there, as well as delusions, which are false beliefs not based on reality. Disorganized thinking and speech, along with reduced emotional expression, are also common symptoms. Treatment typically involves a combination of antipsychotic medications, therapy, and support services to help manage symptoms and improve quality of life. Attention Deficit Hyperactivity Disorder, or ADHD, is a neurodevelopmental disorder characterized by persistent patterns of inattention and hyperactivity that can significantly impact daily functioning. Symptoms usually emerge in childhood and may persist into adulthood. Inattention symptoms include difficulty sustaining attention, organizing tasks, and following through on instructions, while hyperactivity impulsivity symptoms manifest as fidgeting, excessive talking, and difficulty waiting turns. Treatment often involves a combination of behavioral therapy, medication, and support strategies to help individuals manage symptoms and improve functioning. Also known as Alice in Wonderland Syndrome, this rare neurological condition causes distortions in perception, particularly related to size and space. Individuals with Wonderland Syndrome may experience sensations such as seeing objects or body parts as larger or smaller than they are, feeling as if their body is changing size, or perceiving the environment as distorted or surreal. These perceptual disturbances can be unsettling and may accompany migraines, infections, or other neurological conditions. Treatment typically focuses on managing underlying medical issues and addressing any related symptoms. Obsessive compulsive disorder, OCD, is a mental health condition characterized by intrusive, unwanted thoughts called obsessions and repetitive behaviors or mental acts called compulsions. Common obsessions include fear of contamination, doubts or intrusive thoughts about harm, while compulsions often involve rituals such as hand-washing, checking, or counting. OCD can significantly interfere with daily functioning and quality of life. Treatment typically involves cognitive behavioral therapy or CBT, medication, or a combination of both to help individuals manage symptoms and improve coping skills. Jerusalem syndrome is a rare psychological phenomenon where individuals visiting Jerusalem experience intense religious delusions or psychotic episodes. This condition is often triggered by religious significance associated with the city and may involve beliefs of being a biblical figure or receiving a divine mission. While most visitors to Jerusalem do not experience this syndrome, those who do may require psychiatric intervention or hospitalization to ensure their safety and well-being. Social anxiety disorder, also known as social phobia, is an intense fear of social situations and interactions, stemming from a fear of being judged, embarrassed, or humiliated by others. Individuals with social anxiety may avoid social gatherings, public speaking, or other situations that provoke anxiety, leading to significant distress and impairment of daily life. Treatment typically involves therapy, medication, or a combination of both to help individuals manage symptoms and improve social functioning. Bipolar disorder is a mood disorder characterized by alternating periods of depression and mania or hypomania. During depressive episodes, individuals may experience persistent sadness, loss of interest or pleasure, changes in appetite or sleep, and feelings of worthlessness or guilt. Manic or hypomanic episodes involve elevated mood, increased energy, racing thoughts, and impulsive behavior. Bipolar disorder can significantly impact mood, energy levels, and behavior, requiring ongoing treatment with mood stabilizers, therapy, and support services. Alien hand syndrome is a rare neurological disorder where one hand behaves involuntarily, seemingly with a will of its own. Individuals with this condition may experience their hand performing actions or movements without conscious control, sometimes in opposition to their intentions. This phenomenon can be distressing and disruptive to daily life, often requiring management strategies to help individuals cope with symptoms and maintaining functionality. Agoraphobia is an anxiety disorder characterized by an intense fear of situations or places where escape may be difficult or embarrassing, leading to avoidance behaviors. Individuals with agoraphobia may fear being in crowded places, using public transportation, or being outside the home alone. This fear can significantly impact daily life and may lead to isolation or dependency on others. Treatment typically involves therapy, medication, or a combination of both to help individuals confront and manage their fears. Hypersexual disorder, also known as compulsive sexual behavior, involves intense and recurrent sexual fantasies, urges, or behaviors that interfere with daily functioning or cause distress. Individuals with hypersexual disorder may engage in excessive pornography use or risky sexual activities, often experiencing shame, guilt, or relationship problems as a result. Treatment may include therapy, medication, or support groups to address underlying issues and help individuals regain control over their sexual behaviors. Jumping Frenchmen of Maine disorder is a rare startle disorder characterized by exaggerated and uncontrollable reactions to sudden stimuli or commands. Individuals with this condition may exhibit extreme startle responses, including jumping, shouting, or mimicking others' actions without conscious control. While the exact cause of Jumping Frenchmen disorder is unknown, it is believed to involve a combination of genetic, environmental, and cultural factors. Paris syndrome is a transient psychological condition observed among tourists visiting Paris, characterized by feelings of disappointment, anxiety, or delusional beliefs about the city. Symptoms may include hallucinations, paranoia, or derealization, often triggered by the disparity between tourists' romanticized expectations of Paris and the reality of their experience. While most visitors enjoy their time in Paris, those who develop Paris syndrome may require reassurance, support, or medical intervention to manage symptoms and ensure their well-being. Piblokto, also known as Arctic hysteria, is a culture-bound syndrome observed among indigenous Inuit communities in the Arctic region. This condition involves episodes of irrational behavior often triggered by extreme cold and isolation. Symptoms may include screaming, uncontrollable laughter, or disrobing in freezing temperatures, followed by a period of amnesia or confusion. While the exact cause of Piblokto is unclear, it is believed to be related to cultural beliefs, social stressors, and environmental factors. Wendigo Psychosis is a cultural phenomenon observed among some Native American communities involving a belief in transformation into a cannibalistic creature known as a Wendigo. Individuals experiencing Wendigo Psychosis may exhibit symptoms such as an intense craving for human flesh, hallucinations, or violent behavior, often driven by fear, famine, or social isolation. While rare, cases of Wendigo psychosis highlight the intersection of cultural beliefs, mental health, and environmental stressors within indigenous communities. Narcissistic personality disorder is a mental health condition characterized by a pervasive pattern of grandiosity, a constant need for admiration, and a lack of empathy for others. Individuals with NPD often have an inflated sense of self-importance, exaggerated achievements, and a sense of entitlement. While some narcissistic traits are common, NPD involves significant impairment in social, occupational, and other areas of functioning. Treatment may involve therapy to address underlying issues and develop healthier coping strategies. Thanks for watching. If you like this video, you'll probably like this one where I explain every drug in under 10 minutes. Let me know your ideas below or on my Discord server. I also have a Patreon which will give you extra bonuses in my Discord if you want to show your support to the channel. In the meantime, stay tuned, more videos to come.